Well, welcome everyone to our next quarterly Stride Lunch and Learn. This year marks our first quarter Lunch and Learn. So the Stride Committee actually met about a month or two ago to reset our theme for the coming year. And this year, the committee members wanted to focus our educational sessions on individual behavioral health topics and education. Last year, we focused more on county benefits and programs that coincide with that, like Doctor on Demand and stuff. And the year before that was on our EAP program. So they wanted to switch focus and focus more on individual health behaviors. So this first one is kicking off with the emerging weight loss medications that are all abuzz in our community and quite frankly across the nation and world. And try to keep this as informational and factual as possible. I don't want to have any opinions one way or another on this. But we'll talk a little bit about the what, whys, hows, whens, wheres, how much for the different products right now that are servicing, and also noting that there are so many other products on the horizon right now that, this will probably be a mute presentation in a couple of months when similar products continue to come out onto the market. But we will get started. If you have questions throughout, you can type them in the chat. I'm not sure if I'll see them, but I will at the end. And then also you can just come on and mute yourself and ask a question if you have, but we will also take time at the end to ask. So we'll get started. So, quick disclaimer, again, this presentation is for education and informational purposes only. I'm not providing any medical advice or treatment options, professional services, things like that. So just information we've collected from some scientific sites and organizations put together here, but not anything that you should absorb personally and dictate your, behavior towards. So we'll get started. Today, we're just going to focus on a few of the common medications. There are a lot of things coming out on the market, and there's just not enough time or information really to cover in 30 minutes. So we're just going to focus on a couple common medications. You probably are hearing Wegovy and Zepbound the most, but their original counterparts, Ozempic and Mounjaro, are probably also familiar terms to you. So we'll be focusing on those two particular medications in our presentation today, but then I'll also talk about some of the emerging stuff and some background behind it all. So how did we get to these what seems to be effective weight management medications? So research actually has been going on for decades. And as early as the 80s even, researchers identified certain peptides and hormones within our body that regulate our blood sugars most effectively. And when they tried to give those hormones in an oral or an injectable form, the acid in our bodies and such just basically deteriorated what the pharmaceuticals were able to replicate. However, they did recognize that this little guy down here, the Gila monster, if you're familiar with this kind of large lizard, can go for long periods of time, months, without eating. And they wondered why, and they recognized that the peptide hormone in the saliva of a Gila monster is very similar to that within the human. However, it somehow had the capability to withstand all of the issues that caused it to break down when ingested in humans. So they synthesized a version of the Gila monster's peptide hormones to be used in the human body, and hence was born type 2 diabetes management medications. Some of the more common ones you might have heard are like Victoza and Byetta. Those have been around for a couple of decades now, and Trulicity came about a decade ago with some pretty good popularity. However, because of the rise of Ozempic and Mounjaro, a lot of them are starting to be non-existent because these two new products have been shown to have even greater effects on the targeted issues. So really what the researchers were trying to focus on was how do we manage blood sugars, right? Because that's what type 2 diabetic individuals struggle with, is how do we manage our blood sugars. And so what they notice is these hormones, peptides, influence when the body is releasing insulin, which is the insulin is the hormone that's going to take the glucose out of the bloodstream and get it to where it needs to be. And that's always not working well in type 2 individuals with type 2 diabetes. So it did great at that. It did great at triggering the insulin release, pulling that glucose out of the blood stream and helping people better manage their blood sugars. One unique side effect they noticed with people taking these drugs was weight loss, which again, we know just in general, if you're overweight or obese, and weight loss can have a significant impact on many different health outcomes, heart disease, stroke, um, certainly type 2 diabetes, but lots of comorbidity issues. So it was sort of a aha, and that usually happens in the pharmaceutical world. They're making a drug for one thing, and then the side effect is even more effective than the original intent of the um, medication. So similar of what happened here. And the weight loss was pretty dramatic, especially in Ozempic and Mounjaro. Um, However, when these products were on the market, you had to be diagnosed with type 2 diabetes to receive these prescriptions. Um, since that time, I'd say in the last 5 years or so, these pharmaceutical companies have created weight management versions so that people get them without a diagnosis. And so that gave way to Zepbound, which is the Mounjaro version of weight loss management, and Wegovy, which is the same thing as Ozempic, but for people who don't have type 2 diabetes diagnoses yet. So they're the same medication, they just come under different names based on if you have a type 2 diabetes diagnosis or not, if you're just using it strictly for weight management. And like I said, there are many more in the hopper. Right now, most of these are injectable versions, so you inject them into the skin once a week. I imagine, and it sounds like by the first of the year, there'll be a lot more oral versions available in similar products. And also, the companies themselves who create Zepbound and Wegovy have oral versions too that they're just kind of hanging on to because there's such a demand for the injectable version. They're capitalizing on that right now. So, oops, too far, sorry. So how do these particular medications work? So Ozempic and Mounjaro, or Wegovy and Zepbound, depending on what we're talking about, are sort of two different products. They have one thing in common, and then one has a little extra peptide in it. So Wegovy has one hormone activated, and that's the glucagon-like peptide 1 receptor agonist. So this basically means it helps the glucagon-like peptide 1, which is, again, that insulin release stimulant, and it also slows the movement of food and the digestion of your food, and thereby decreases your appetite because you've got food in your stomach longer and in your intestines, so you don't have that hungry feeling as often. And in response, obviously, because we have more insulin working better, we're removing that glucose or that sugar from the bloodstream. Again, helping type 2 diabetes, but in the process, we know that when we don't have a lot of insulin irregularity and we don't have a lot of blood sugar in our bloodstreams, we're less likely to be storing fat, which is what's going to be leading to that weight loss side effect. Zepbound functions in that same process, but they've added a second component which activates another hormone, the GIP receptor, and I can't remember what they all stand for, but this one is also going to trigger some hormones in the brain that trigger when you're hungry or when you're satisfied. So not only is it slowing the movement of food and digestion so you feel full and stimulating that insulin release, but it's also triggering your brain to think that it's not hungry. And this has been shown to be a big thing as far as people who suffer with terrible cravings. Many individuals report that weight gain is really attributed to cravings more so than other things. And so this has been shown to be helpful for them. And in studies, Zepbound shows a little bit higher weight loss percentage than Wegovy. Both of them are really high as far as a weight loss drug is concerned. But because of that extra little hormone, the studies do show that Zepbound participants tend to lose a little bit more weight than Wegovy participants long term. Again, the overall effect is still the same. They're releasing insulin to be more receptive to pulling that glucose out of the cells, which again is going to help those with type 2 diabetes. There are lots of benefits of these products. Obviously, we talk about the type 2 diabetes management of blood sugars, huge. But again, another side effect is weight loss. It generally starts pretty early into the use. Within about a month or 4 weeks, you'll notice some pretty significant or I guess for most people, motivational weight loss. It can be kind of depressing if you're doing it the old-fashioned way, where it's maybe a half a pound to a pound a week, and this is a little bit more considerable and noticeable. So that gives, again, the motivation factor intrinsically to a person to want to continue. After about a year and a half of use, participants in studies have lost between 15 and 21% of their weight, which is pretty significant, especially if you're someone who's severely overweight, obese, or strongly overweight. We talked about type 2 diabetes. Obviously, if we're losing any sort of weight or regulating our blood sugars and stuff better, we're going to have lower risks of heart disease, less issues with sleep apnea. It's been shown also to slow the progression of kidney disease for like alcohol abuse or things like that. This area is really starting to, I guess, spike the interest of researchers because they're finding like, oh, that is possibly another way we could look into how to use these medications for other serious issues and many other comorbidities that are associated with excess weight. So there are benefits to using these products beyond just weight loss for many individuals. There are, however, plenty of side effects and contraindications for using these medications as well. So we'll go over some of the more common ones here. Obviously, with the slowing of the digestive system and that food moving through our intestines and bowels, there's lots of digestive issues that come as side effects with these products. So nausea, diarrhea or constipation, vomiting, stomach pain, indigestion, even headaches and feelings of tiredness. So most people are like, oh, maybe I'd get more energy, but some of the side effects noted do include more fatigue. Some less common, but also possible side effects include hair loss, more gassiness and bloating, and dizziness. And then also there's a huge lack of concern for the availability of these products, especially over this last summer. There's been a huge demand for these products, so much so that the pharmaceuticals really couldn't keep up earlier this year. And because you have to take these products once a week, missing that dosage because you can't find the product can lead to just your body not reacting well to the series, so and you experiencing some more side effects. So that was a major concern as well, and just something to think about if you're considering these products. There are two huge contraindications to using these products. Do not use them if you or a family member have a history of medullary thyroid cancer or multiple endocrine neoplasia syndrome, type 2. Again, just because of the interactions there with those hormones. So definitely contraindicated if you have any history or worry about those conditions. There are serious complications. These products have not been studied long-term as far as like decades yet on what the long-term implications are, but these are some things that they're starting to notice. One thing I don't think I mentioned yet is these medications were meant for long-term use, not just a quick fix and get off of them and then live your merry, happy life. They were meant for basically a lifetime management tool for type 2 diabetes. And now that they're used for weight management, no one really quite fully knows the implications of coming off these products after a short term or staying on them for very long terms if you don't need help managing your blood sugars. So there are some serious complications people are noting: kidney problems, gallbladder problems, pancreatitis is probably at the top of the list, hypoglycemia, stomach paralysis, and digestive organ complications, and even tissue death. So if you think about it, you're really slowing down that food moving through your digestive organs. And so basically you're kind of trying to paralyze it, so to speak, because you're trying to slow it down, and you know, over time that will definitely just lead to diminished use of those organs and their ability and lead to tissue death. So similar to, even, you know, these are muscles in our body, so similar to like, you know, your bicep or your calf muscle, if you don't use that, you lose that muscle tissue, right? And so same thing here is going to be what we're experiencing. Cost is a huge factor when it comes to using these products. So if you do have type 2 diabetes and your doctor thinks this is a good medication, your insurance company will probably help support cover this. However, if you don't have that diagnosis on your chart, it's often not going to be covered. Very few insurance companies offer coverage for these weight management versions. I checked in with Wellmark and they do not cover it unless there is a type 2 diabetes diagnosis. And generally, even then, they might fight it until they've shown that other options have failed or the individual is not responding to other treatment options. So without coverage, the cost of Ozempic or Wegovy can range anywhere from $900 to $1,500. And that's just for a 1 month supply. So again, you take one injection a month. So it's about 4 injections a month that you're paying for. So several $100s per pen, basically, for those products. And like I said, with commercial insurance, sometimes they'll provide a little bit of coverage, not all, depending on types of diagnosis that you can prove and that your insurance provider will approve of. And a lot of times we're seeing this case by case basis. Medicare certainly is not covering this product yet because they view them as lifestyle drugs. So they are not on the Medicare coverage prescription list yet either. Both of these companies, so Novo Nordisk and Eli Lilly, both offer coupon vouchers for the medications. Some are up to 12 months long. That can significantly reduce the cost. It's still going to be, several $100s a month probably, but not $1,200. However, those coupons are going to expire and then you'd be stuck with the full-time cost. And I think just something to note is don't think of these medications as a quick fix because they are meant to be long-term use. So just thinking you can afford to do this for a couple of months and then get off it is probably not going to be in your best interest because of what we're seeing in the studies of people coming off these and putting their weight back on. So just things to keep in mind. There are, because of the popularity, and then of course, because of the lack of availability of these medications, lots of alternatives are starting to pop up across the markets. Some of these markets are not regulated by the FDA, so I definitely want you to realize that. The products themselves are pretty easy to make. And so a lot of compounding pharmacies are making their own versions of GLP-1 supplements. They're significantly less expensive. However, like I said, they're not well regulated right now. And state pharmacy boards are trying to catch up quickly because it's such a new kind of fad and trend that they don't have the oversight and stuff built up for these new products. And so they're definitely playing the catch-up game at the state level as well as the FDA level because they just weren't ready for this wave of interest. Most of the compounds, the substances that they're getting are often produced outside of the USA. So sometimes that's of concern too, as far as clarity and the potency and just the safetiness of those products. And many are being sold illegally just through online markets as well, because they can, again, bypass all that regulation and kind of be an invisible distributor, so to speak. So again, I definitely caution people who are using the off-label versions to definitely be working with your provider if that is the option they want you to take, but certainly many risks associated with those. Talk a little about the long-term impact and outlooks for using these medications. One, because like I said, there is such long-term use with these. One of the things studies have shown is significant amount of muscle mass is lost using these. Up to 40% of the weight lost is muscle mass that's lost. And we know muscle mass is like gold to our body. And if you don't know that, hopefully you know that now. But the more muscle mass you can put on the body, the healthier it's going to be, the more metabolism, the higher your metabolism is going to work, your engine's going to be running smoothly. You're probably going to have an easier time with weight management, the more muscle mass you can have had. Traditionally, if you do the old-fashioned way of just diet and exercise, you're still going to lose a little bit of muscle mass when you lose weight, but it's significantly less attrition than with these medications we're finding. So between 15 and 25% of your weight would be muscle that's lost when you lose weight. So in this case, the old-fashioned way definitely is superior. And in my, I would just say long term, the more muscle mass you can put on, the healthier and more longevity you're going to add to your life. So that's a good thing to keep in mind. Again, long-term studies are still in process. Evidence suggests that long-term use is necessary to sustain weight loss. Those that come off it have shown to put the weight back on. Um, Lifestyle modifications are essential to long-term success as well. It is sort of the magic pill people are looking for, but it also, to really truly work long term, you need to improve your diet and activity behaviors if they weren't in good standing before. So those things you don't get a pass for those things. You definitely need to also make sure that you're eating healthy and regularly active. A lot of these people are eating a lot less, again, because their appetites are lower and the digestion's lower. I think loss of vitamins and minerals is something to also keep in mind because you're not getting as many calories in food as you once were. And so there could be some side effects as far as nutrient depletion and stuff too. So be thinking about that. And again, there's those more serious complications of pancreatitis and digestive paralysis for long-term use on these products as well. I've heard a couple cases where it was even short-time use and they were experiencing some paralysis, but those are not in high numbers yet. So I can't end without sharing from a wellness perspective natural ways to boost those peptides in our body that are similar to what you could get in Wegovy and Zepbound. So you can find GLP-1 in nature. Lots of fermentable foods have this peptide in them that the body can then use to create the same effects as Zepbound and Wegovy. So things like artichokes, onions, asparagus. Oops, I have artichokes twice, sorry. Fruits, apples, and bananas. These are all high fermentably rich foods that are good to add to your diet. Polyphenols, we talk about these a lot. Some higher foods with polyphenols include pomegranates, berries, mangoes, green teas, coffee, chestnuts, cocoa, kale, spinach. So all those greens that we always talk about pushing on people. Whole grains, lean proteins, and then for an extra added boost, if you add calcium while you're eating your lean proteins, so a glass of milk with your meat, an extra supportive kind of boost to get that GLP-1 working in the body. Healthy fats, exercise can boost it. Managing your stress will deplete it. So having good stress management and adequate sleep, which again is tagged into stress. So if you would just look at that list, right, it's what we've always been preaching: healthy lifestyle, good variety of diet, foods, staying active. And if you think about the people who follow that, they typically don't have troubles with weight often. If it's due to an imbalance of blood sugars and stuff like that. So again, practicing what we've always known can be just as helpful as boosting your GLP-1 through medications. So don't forget, you can do things on your own and it costs you a lot less. So we will end. I got about 5 minutes. So if there's any questions, you can come off mute or you can put them in the chat and I'll do my best to try to answer them. I'm not an expert in these, but I can try my best to help point you in the right way, at least. One thing I didn't mention that I will, there's a lot more stuff about peptides coming out too. So we'll try to put some stuff in the newsletter around as more information about beyond just the GLP-1 peptides that we're using. So
Kelly, can you hear me?
I can go ahead, bud.
What kind of withdrawal symptoms can we expect from somebody who's on it? And then should they gradually get off it? Should they just stop cold turkey? Or being this is all new, I've got a few guys that are on it already losing weight. Are they going to have to be on it forever? Or are they thinking, because a couple of them, they're thinking, we'll be on it a short time till I reach a goal and then I'll be off.
Yeah, so good question. And I didn't talk a lot about like the dosing of these products. So when you start the products, you start at a very small dose and each week you kind of add more and the doctor will work with you to increase the amount of medication you're getting to slowly get your body used to it. Most of the time when people come off of it, what people will notice is some of those like physical symptoms of an increase in appetite because again, their bodies are like, oh, yep, now I'm hungry because I'm not slowing things down anymore. Their blood sugars might be going a little haywire again. So those are some of the one things I've heard people say their cravings are much different. Like they'll crave sweets or just really unhealthy foods when they come back off of it. Most start to put weight on again, like I said, unless they're really good about monitoring and really changing that diet and exercise pattern. Um, but I'd say the biggest ones are probably going to be like a much bigger appetite, so that can lead to overeating and cravings coming back, which are two things we want to avoid, right? If we're getting off of it, because that's what got us maybe in trouble in the first place. But those are two of the bigger ones. Good question. Anyone else? If not, I will stop it now. And if you do have questions, you can shoot me an email. We did record this, so we will post it to the YouTube channel, the Stride YouTube channel. So if others couldn't make it, they can view it, or if you need to go back and remember what was said or look at the slides, you can do that. But thanks for jumping on. We'll see you guys later.